patients, and the families. Today, we are honored to have Dr. Tarun Kumar, a gastroenterologist from New Delhi, as our guest speaker. So, is one of the leading gastroenterologists and hepatologists with over 14 years of experience and specialization in therapeutic and diagnostic endoscopy. So, is actively involved in various research programs and has authored several articles on both national and international level. Sir is currently working as Associate Director Gastroenterology and Hepatology at BLK Max Super Specialty Hospital, New Delhi. We are grateful for his dedication to improving liver health and educating others about this important topic. Without further ado, I would like to invite Dr. Tarun to share his valuable insights on the management of MASLD or MASH. Over to you, sir.
Thanks, Tapan, for a very kind and generous introduction. I am very grateful to the team from Zydus to help organize this wonderful meeting. NFLD or MSLD, as it is called these days, it's a very important and perhaps the fastest growing health problem in India right now. Every third person, every at least 30 to 40% of people in India are having fatty liver disease right now in India. And it starts as early as the age of 18 to 20 years. That means young children as young as 18, 15 to 20 years of old are having fatty liver disease, which in long term will invariably lead to adverse outcome in the form of liver disease, which can involve liver cirrhosis, chronic hepatitis, cancer, and ultimately leading to liver failure. NFLD is not a disease, NFLD or MSLD is not a disease which is just restricted to liver only. It is said that all the diseases starts, it is our old Indian saying that all the disease starts in the liver. सारी दुनिया की बीमारी हमारे जिगर में है. And it's perhaps true as well. The onset of most of the disease like cholesterol, like diabetes, like cardiac issues, like stroke, all these problems, they start basically the starting source of all these problems lies. It is a recent scientific knowledge that all these problems are starting because of the abnormal metabolism in the liver, which is arising out of the metabolic abnormality, which arises out of non-alcoholic fatty liver disease. So it is one of the most important area of interest for us, and it is one of the most area for the patient also. Because if you keep your liver healthy, then only you can be rest assured that your lifestyle is going to be healthy. So how does it happen, the fatty liver disease? It is because of the imbalance in the amount of nutrition that we take and the nutrition that we spend. So if we take surplus calories and we don't spend that much calories, that those calories get stored in our liver in the form of fat. So normal fat in the liver is around 5 to 10%. So once this fat crosses 10% of the liver volume, it is called as fatty liver. Once it crosses a threshold of 40%, it is called as a bad fatty liver, which is detectable on the ultrasound and which leads to abnormalities in the LFT and ultimately adverse outcome. Most of the patients that we are seeing, they have fat deposit in the liver in the range of 50 to 60%, which is very high. So it all has happened over the last 30, 40 years because of our dietary habits, because of our sedentary lifestyle, because of the lack of exercise, and because of the fried and fatty and processed food that we are eating at the restaurants, at the fast food corners, and at the street food corners. Without taking account of the calories that we are eating, without taking account of the sugars that we are taking, and without taking into account the amount and the quality of fat that we are eating. The quality of fat is also important, but it's not only the amount of fat, but it is also the quality of fat which is important in what we are eating. The better oils like olive oil and the avocado oil, these are the better source of oil. If we take these oils in moderate amount, probably will not cause harm. But normal like oil like ghee or refined oil, they are bad for liver. They leads to fat deposit in the liver. The thing which is most commonly ignored, we like to add sugars to our every meal, like sweets and sugar to our every meal. This is causing accumulation of large amount of fat in our liver, and which is, if I have to point out between fat and sugar, I think sugar is worse than fat in terms of fat deposit in the liver. So this is about for the patient perspective how fatty liver disease happens. It's because of the surplus of fat and energy that we take. How it is manifested? It is manifested by the changes in the LFT, which you see on the routine and LFT imaging and on the ultrasound. How do we confirm it? We confirm it with a special kind of ultrasound, which is called as fibroscan, or some blood test, which is called as Fifth four is another screening test for detection of fatty liver disease. And once we find it out, we'll try to look for the other associated medical abnormalities like diabetes, like dyslipidemia, like presence of coronary artery disease, like presence of any cerebrovascular disease. And once we have ruled these diseases in or out, then we proceed to the management. The management as of now involves only two drugs. Drug wise, the most important part of management is lifestyle changes, which include significant dietary reduction and exercise, which can be both strength building as well as a cardio exercise. So it is generally recommended that you exercise for at least 150 to 200 minutes every week, and you restrict your caloric intake by at least 30 to 40% if you want to make your fatty liver better. It is said that to make fatty liver revert back to a normal status, you need to lose at least 5 to 10% of your existing body weight. So, like a person weighs 100 kg, then he has to lose at least 10 kg. Then only we will able to see significant detectable improvement in his liver profile. And as far as the drug management is concerned, there are only two drugs available right now. One is vitamin E, and the other is pioglitazone. Vitamin E is used in non-diabetic patients, and pioglitazone is used in diabetic patients. Other newer drugs which have shown some promise are saroglitazar, which if taken for a prolonged period of time leads to reduction in your cholesterol level and also leads to improvement in your liver profile. Newer weight loss drugs like semaglutide, which is commonly known by the brand name of Ozempic, and liraglutide, and some latest drugs like Vego, uh, Padaglutide. These help in reduction of weight loss and as well as improvement of the liver profile parameters. So this is a brief introduction to fatty liver disease. And if now I think it's better that we take questions from the people who are attending. Hello, Tapan.
Right, sir.
Yeah.
Uh, Let me check the queries, right? So first question we have is fatty liver reversible, or once it has happened, we have to live with it forever? So you are in mute. No, sir, you are on mute, sir.
Okay.
Right.
Yeah. So it is very much reversible, and I think this should be the focus of our discussion today. Lifestyle change is the most important thing. Dietary reduction to the extent of 30 to 40% of your pre-existing diet. I think that's the biggest change that you can take from day one to make your liver better. As I've already said, for see if you have like grade 2 or grade 3 fatty liver, you need to lose at least 5 to 10% of your body weight. That will make the grade of fatty liver from grade 3 to grade 2. It will bring your grade 3 down to grade 2 and grade 2 down to grade 1. So if you lose further weight like 5, 6, 7, 8 kg more, and that will lead to almost complete normalization of the liver fat, which is like 5 to 10% of the liver volume. So it is very much reversible. Drugs can help in it, but ultimately it's your lifestyle changes, the diet and the exercise, and cutting down on fat and sugar in every extent. So your primary target of weight loss should be in the next 1 year, I'm going to lose at least 10% of the body weight. So that's the idea which we want to convey through this meeting.
So talking of lifestyle changes, we have
Yeah.
two questions on that. I will take the first one. Uh, the first question is like, what is more beneficial? Very hard or strenuous exercise is beneficial, or light exercise are beneficial in case of fatty liver?
See, if you have lived a sedentary lifestyle for a long period of time, it will be very hard for you to take strenuous exercise immediately. You will have to start with a light, brisk walking. The brisk walking is called as once you start walking, you should not be able to talk. You should be losing breath so much, and you should be sweating. This is called as brisk walking. That you should not be able to talk. You should be able to walk with this kind of speed for about 35 to 40 minutes. This is the minimum that you need to do every day. Like, and for a week, at least around 150 to 180 minutes every week. So this is how you can start, but gradually you can build upon that. Light running, jogging, and maybe some small, like 4 or 5 kg dumbbells or 6, 7, 8 kg dumbbells, which you can build for a strength exercise as well. So both strength as well as cardio, which includes running, jogging, and bicycling. So all these things can be done in basically one day you can do strength building, one day you can do running and jogging. So you have to combine, mix and match both. Ultimately, it has to come down to like 150 to 160 minutes every week.
And the sir, second question is you also talked on diet, right? So,
Yeah.
where you mentioned that we should reduce on calorie. So the question was like, to what amount of calorie should we reduce, or what should be the maximum calorie we can take when we have fatty liver?
So see, this question, at least for our Indian population, is very important. We have never taken measure of how much are we eating every day. We people say that I don't eat anything. I only do two chapatis every day. Have you ever seen the amount of calories in a cup of cold coffee, in a samosa, in a rasgulla? See, a rasgulla is like 300 to 400 calories. To burn 300 to 400 calories, you have to spend 45 minutes to 50 minutes exercising. We don't realize this thing. A cup of coffee with cream is like 500 calories. So burn that amount of calories, you need to spend at least 1 hour in gym. So our Indian population don't realize that we don't eat anything. But if you take into account in between snacks that we are doing now, that is causing more harm compared to the regular meals. So first thing that we should do is to completely take out in between snacks. That is not acceptable. Any kind of sweets after the meal, like we have the habit of taking sweets after every meal, it should go out, completely go out. This cannot be the way of living for a long time. You can take sweets once in a while, but not every day. We have a tendency to eat sweetened product 2 or 3 times a day, which is not acceptable. And ultimately, the target has to be cutting down of your meal, like whatever you are eating, it has to come down by at least 30 to 35%. So if you are eating three chapatis, you need to eat two chapatis. If you are eating a full plate of rice, you need to cut one third out of it, and no sweets, no snacking. Uh, the snacking has to completely go out. I think what I have realized, our main amount of main meal is actually less, but it is the in between snacking which is causing our population a lot of harm. So that would be my dietary advice to the population: the snacking and sweets. It should be absolutely sugar less. Your diet should be absolutely sugar less.
So very rightly said, sir. Kuch meetha ho jaye has become a slogan for every
Yes,
household,
yes,
and
yes.
now we feel that that is the biggest blunder we are having.
Yes, it's a blunder. It's a blunder. You cannot have a sweet after every meal. This is
Right, sir, right.
no, yeah,
And we also feel proud that we are having sweet every day, but actually
no,
it is
no,
very wrong.
no, 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 no. I
Right,
think
sir.
as I've already said, if you have to give me a choice between fat and sweet, I will pick fat. I will not pick sweet. Sweet is a bigger harm.
Right, sir.
Yeah.
Thank you, sir.
Mm.
Next question we have is like, is MASH or MASLD or fatty liver uh, any age specific? Like it happens only after 30 or 40, or it can
So
be it can happen to kids also, sir.
yeah, yeah. This actually we are seeing kind of a mini epidemic of fatty liver disease in India. Kids as young as 15 to 20 years of old are having fatty liver disease, and we don't know, like in 20 years from now, the manifestation of fatty liver in India will be immense, in form of liver failure, liver disease, and liver cancer. I think we are going to be seeing kind of a burst of these problems in India in the coming era, in the coming decades. I think kids as early as the age of 15, 20 years are having fatty liver disease. If you do their fibro scan, their fibro scores are also going up, which was like unheard of at least 10, 15, 20 years back. Things have really changed over the last 15, 20 years, especially with the adding of alcohol from the very young age, like kids, boys as young as 25 years of 20, 25, 22 years of age are having alcohol very liberally, which is adding to the burden of already existing dietary abnormalities that we are having. So it's a combination of both alcohol as well as fat, which is causing immense damage to the liver. And I think in the coming decades, we are going to be seeing a lot of problems related to these problems. To keep people as early as people as young as 40 to 45 years of age are going to be having significant liver disease, which we used to see at the age of 60, 65 years. So let's prepare for the impact of the lifestyle that we are living these days.
Right, sir.
Oh.
And sir, talking of alcohol, we have one question. where the question is like this. Uh, is there any difference between the lifestyle modification that we need to make in case of alcoholic fatty liver disease and this non-alcoholic fatty liver disease, or it holds true for both of them?
So, see, it's see that's what it thinks the definition that we have changed over the year. We have changed the name of the disease of NFLD, non-alcoholic fatty liver disease, to MASLD. So let's be honest about it. None of us are completely teetotaler. Everyone likes to have a drink someday or the other, and none of us are like heavy drinkers. Most of us are not heavy drinkers. Like every day we are starting from morning to evening. So that's also not the case. Most of us are like we take once or twice in a week, two or three drinks at one time, maybe once a week or maybe two times a week. That by definition would be classified as a metabolic, predominantly MSLD. Like it will be predominantly fatty liver disease, but with a combination with a contribution of alcohol to it. So that's why the definition has changed over the last 1 year. We have started to label these problems as primarily fatty liver disease, which is MSLD, or MET-ALD. It is metabolic alcoholic liver disease. So if the primary distinction is toward metabolic alcoholic liver disease, then the alcohol is the first thing which should go out. Alcohol anyway should go out. Anyone having significant fatty liver, significant abnormality on the ultrasound on the LFT should restrict their alcohol intake to not more than once a week, and that too maybe one or two drinks every week. If they go above and beyond that, the liver is going to be suffering two insults. One is fat, the other is alcohol. So, if the source of primary damage, like we basically quantify it according to the amount of alcohol the patient is taking. If the patient says that he takes alcohol around 3 to 4 days a week, then he would be classified as having MET-ALD, metabolic alcoholic liver disease. If he takes alcohol around once a week or twice a week, then he will be MASLD, metabolic associated steatotic liver disease. So the definition has changed over the years. Nothing is like concrete. This is NFLD, this is alcoholic liver disease. So we have basically a mixed picture these days. So that is about the recent nomenclature of the disease.
And so one last question we have is, uh, one of the person has asked that I am more sort of a healthy kind of person. So how do I come to know that I should go for liver test or not? Means what are the silent symptoms I should look for it? Probably the person is asking like that.
So in the initial stage, you will not feel significant symptom. Maybe some right upper abdomen heaviness, some lethargy, some fatigue, some dyspepsia symptom like you eat something and your stomach gets bloated. Maybe some episode of like you eat something heavy at night and you suffer from bout of indigestion and vomiting at the night. These could be some initial symptoms. But later on, you will have constant dragging pain in your right upper abdomen with fatigue, with the onset of other problems like diabetes and cholesterol problem. So it is generally said that LFT at the age of 30-35 years is a basic minimum requirement that you should do. With that, we can proceed to, if your LFT shows some abnormality, then we can proceed to an ultrasound and a virus test. If virus tests are normal, then and the ultrasound shows significant abnormality, then we can proceed to second line of investigation, which includes tests for your cholesterol level, your fibroscan, which will tell you the exact estimate of the liver problem that you are having. So the initial test, LFT at the age of 30-35 years, I think is sufficient. With that, we can stratify you according to the problem that you're having. If your LFT is perfectly normal and you're of normal body weight, we would not like to worry too much about your liver at this point in time. But if the LFT is abnormal and your BMI is on a high side, 26, 27, 28, then we would definitely investigate you for fatty liver disease.
Right, sir? So these were the few questions. Any last words from your side, sir?
Thanks again, Zydus team, for this wonderful Facebook meeting. And I hope that we keep having these meetings because I'm really worried about the amount of fatty liver disease that we are seeing in this country. And prevention is the only cure. We are doctors. We like to prescribe drugs, but in this disease, at least I can say drugs are not very effective. You have to take control of your lifestyle. You have to eat healthy. You have to exercise. You have to go back to your previous lifestyle of being more having more exertion in your day-to-day life and eating less and maybe working out more and cutting down on the snacking and alcohol and other bad things. I think if we don't do that, then we are going to be seeing a huge problem of fatty liver disease in this country, which will be unmanageable, at least for the common physicians. And the specialists would not have sufficient time to manage these patients. I think the onus lies on us and you, the Zydus people, to basically propagate this message all across the community that we have to be aware about this. There's no shortcut. See, like small incident like this thing happening, we make a lot of news out of it. This disease is killing a lot of people every day, fatty liver disease, and we are not paying any attention to it. And I think the pharma company, the doctors community have to come together and maybe spread this message all around that we cannot let this epidemic of fatty liver disease go unnoticed, and we have to take some actions. Thank you, and with that, I conclude my talk.
Right, sir. We are there with you always on any of the, issues or patient
Yeah.
awareness initiatives regarding fatty liver disease.
Mm.
And on behalf of NASH 24 by 7, I extend my sincere thanks to Dr. Tarun for his enlightening and engaging talk on MASLD. Sir's insight have highlighted the critical need for increasing awareness about fatty liver disease and related conditions. Moreover, Sir has explained us very well how commonly we do mistakes and how do we, how avoiding simple things like taking sweets after the meal can help us reduce our daily caloric diet and, move towards a healthier life. I also want to express my appreciation to the audience for the active participation, for the queries that they have raised, whose answers were valuable for others also. Your feedback and suggestions are essential as we strive to enhance our future Facebook Live programs and educational initiatives. Please stay connected with Nash 24 by 7 on Facebook for updates and information on upcoming events. Remember, your health and the health of your loved ones are paramount. Take care and stay well. And once again, I thank you one all and Dr. Tarun Kumar for guiding us on fatty liver disease. Have a nice evening.
Thank you. Thanks, sir.